Hello, everybody. Thank you for registering for the Gallbladder Cure with Homeopathy webinar. My name is Sonika, and I'm pleased to introduce our esteemed guest, Dr. Nirmal Guru. Dr. Nirmal is an experienced homeopathy specialist in Chennai, India. He is an eminent homeopath with 19 years of experience. He has worked on so many activities during his post-graduation, like visited the various pharmaceutical industries on their functionings, like Dr. Bilba Schwabe, India Limited, Noida, UP. And currently, Dr. Nirmal is working as a part-time professor at Maria Homeopathy Medical College, Tiruvattur. This webinar is brought to you by Alternative Health. Alternative Health is the first telemedicine portal dedicated to complementary and alternative medicine. With more than 38% of US population and over 50% of people all around the world using alternative therapies, the demand for such a platform has become very high. During this webinar, Dr. Guru will share valuable insights about gallbladder health that can significantly impact our lives. Our goal is to help you live a life free of those high medications, which have usually some adverse side effects. With Dr. Nirmal's guidance, you will learn on how homeopathy can eliminate the need of such medication and maintain a healthy life. Without further ado, I would like to invite Dr. Nirmal Guru to present today's session, Improving Gallbladder Health with Homeopathy. Over to you, Dr. Nirmal.
Hi all, thank you Sonika. Thank you for giving such a nice introduction about me. And friends, today we are going to see about Save Your Gallbladder with Transformative Magic of Homeopathy. First, I would like to give small introduction about homeopathy. Homeopathy is the mainstream medicine in Europe before 200 years. It was discovered by Dr. Hahnemann, Samuel Christian Frederick Samuel Hahnemann, and it has been used all over the world as a second largest medicines of the world. So by using homeopathy medicine, we can save our many organs like gallbladder, appendix, tonsillitis, uterus, and ovaries. These are the major things which are removed easily from our body by the so-called modern medicine. But by using homeopathy medicine, we treat the patient as a whole. We don't treat the disease, we treat the person, we treat the individual. So that's why homeopathy we call as holistic medicine. Right. So what is gallbladder? Second slide, please. The gallbladder is a small pear-shaped organ that's situated beneath the liver, just under your liver. It will be a pear-shaped organ. Its primary function is to store bile. It stores bile. The bile is the fluid which is secreted by liver that helps to improve the digestion of whatever fat you consume. Any oily food, fatty food, animal proteins, whatever you consume, that helps to digest. So bile is a emulsifier. It dissolves fat easily. Next slide, please. So what are the functions of gallbladder? The gallbladder helps to store bile. Whenever you consume fat, the gallbladder releases the bile. And the bile has to be maintained in certain pH. The gallbladder helps to maintain the pH perfectly. And absorption of certain vitamins in our body. So gallbladder is the major organ which helps to digest the fat and stores the bile, releases the bile whenever we need. If we remove the gallbladder by doing cholecystectomy, many digesting diseases will come. Next slide, please. Okay, what are the diseases it can affect gallbladder? Mainly three diseases we can say. One is gallstones, another one is inflammation of the gallbladder, that is cholecystitis, and another one is gallbladder polyp. In these three diseases, most common diseases are gallbladder stones and cholecystitis. Gallbladder polyp, it won't have any symptoms and it would not cause any trouble to you. So we will see about gallstones and gallbladder in the next slides. Next slide, please. So gallstones, what are gallstones? Gallstones are hardened collections of bile materials that develop in your gallbladder. Why the gallbladder stones are formed? So whenever we see a non-veg food, whenever we see a fatty food, whenever we see a oily food, our pituitary orders liver to secrete a bile. The bile will be secreted and it will be stored in gallbladder. Whenever we consume a fatty food, the gallbladder contract and it emits the bile for the purpose of digestion of fats. But due to some causes, your gallbladder will become non-functional. So that we call as non-functional gallbladder. That time, the bile is not excreted or sent out for the purpose of digestion. So the secreted bile will be stored long time, long duration in the gallbladder. That forms as gallstones. So that may be small grains. The size of gallstones may be small grains, sludge, or up to the size of the golf ball. The gallstones will never cause any symptom unless it get obstructed in the bile duct. That is common bile duct. The duct, it is from where the bile is entered into the intestine. It's a smaller stone always cause problem. Whenever the small stone that tend to excrete through the common bile duct, it may get obstruct in the bile duct, will cause severe inflammation and pain in the abdomen area. Next slide, please. What are the causes of gallstones? High cholesterol levels and excess bilirubin, excessive secretion of bilirubin, and gallbladder stasis. Stasis means stagnation of the bile in the gallbladder for prolonged duration, and obesity. Obesity is the major cause of many diseases, and gallstone also one of the disease comes under overweight. Next slide. What are the symptoms of gallbladder stone? Right. Mainly, there will be annoying pain in the region of liver. Beneath the liver, you will be having annoying pain, and the pain may be radiating to backside also of the right side, beneath the scapula. And there will be consistent nausea and vomiting for particular time period. And jaundice, if the obstruction is severe, you may get jaundice also. Few cases, we can see fever and chills also. Whatever you eat, there will be consistent bloating and gas formation or flatulence in your abdomen. The bowel movements will be changing. There will be constipation and there will be diarrhea. So alternate thing will happen in gallbladder stones. Next slide, please. What are the diet we can consume when you are affected with gallstones? Mainly, we have to avoid animal proteins, any fatty foods, which may cause secretion of the bile, because the constant secretion of bile leads to more and more stasis in the gallbladder, which may develop gallstones more severe. If you are not taking too much of fatty substances, the secretion of bile will be little more less, and treating the patient is easy. For example, you can take brown rice, oatmeal, broken wheat, ragi, and quinoa. Milk and skimmed milk you can take, and fish like tuna, salmon, mackerel you can take. You can take white of egg. Along with that, try to reduce this cold pressed oils. Instead, you can take rice bran oil, olive oil, and quinoa oil. And you can take all kind of pulses. But before taking the tur dal, you can go for a small fry, and then you can, because that helps to reduce the formation of flatulence. So in this way, you can reduce getting frequent attacks of gallstone attacks, pain attacks, and the flatulence. Next slide, please. What are the food that you have to avoid during if you are suffering with gallstones? Mainly avoid animal proteins like beef, goat, etc. And avoid taking too much of sodium. That is too much salty foods you can avoid. And oxalate and vitamin C foods you can avoid. And you can restrict potassium, caffeine, and alcohol too. Because whenever you take alcohol, definitely there will be impact in liver. So restrict alcohol if you are suffering from gallstones. Next slide, please. And what are the foods you can eat during or on the treatment of gallstones? Drink too much of water, stay hydrated, moderate protein intake, limit sugar intake. Whenever you are taking too much of sugar or sweets, definitely it will affect your gallbladder. And water soluble fiber. You can take more of fiber and do small workouts like walking, pranayama. These things will help to improve your overall metabolism. Next slide, please. Don'ts foods items in gallbladder problem. Whenever you are suffering with gallstones, avoid drinking a lot of coffee, tea, and alcoholic beverages. And even you have to avoid this Red Bull, sodas, and carbonated drinks because it causes too much of flatulence in your stomach. And highly salted food like chips and all, you have to avoid. And avoid oxalate containing food, nuts, black tea, green leafy vegetables, soya, and chocolates. These foods definitely will have stasis that promotes the stasis in gallbladder and worsen the symptoms. Next slide. How we can diagnose you are suffering from gallstones? Mainly the symptom, whatever you come to the clinic and you may narrate the symptoms like this. Doctor can clinically diagnose this may be the cause for, this may be the reason of gallstone. This pain is because of gallstone, like that we can conclude. But conclusively we can say, yes, this is gallstone. We have to go for ultrasound, abdomen, and few blood tests can detect whether your gallbladder is infected or you are suffering from jaundice. Those things can be done with blood LFT, liver function test. We can conclude whether it is you are suffering with obstructive cholecystitis or jaundice. Next slide, please. This cholecystitis, the second disease most commonly affected by gallbladder. Cholecystitis is a small inflammation of gallbladder occurs when a gallstone blocks in the common bile duct. Whenever the small stone that try to exit from the gallbladder, it may get stuck into the common bile duct. That will cause inflammation of the gallbladder. Usually develops whenever the small stones try to escape from the gallbladder. It may get obstructed in the common bile duct. That time it may get affected with bacteria also. So the cholecystitis, whatever inflammation caused in your body, will lead to severe fever, rigor, chills, and there will be severe pain in your abdomen. That may lead to even vomiting, nausea, and even diarrhea also. Next slide, please. So already we discussed this common biles, this cholecystitis is caused due to obstruction of the gallstone in the common bile duct, and it may get infected because of the obstruction. So less common cause include bile duct scarring, reduced blood flow to the gallbladder, tumors, some tumors that may block the flow of bile from gallbladder to intestine, or viral infection that inflame the gallbladder. So these are the causes for cholecystitis. Next slide, please. Prevention. How you prevent from the attacks of cholecystitis? Eating a healthy diet. Healthy diet means try to avoid eating fatty foods, oily foods, fried foods, and animal proteins. And keep exercising, keep moving. You have to do minimal exercise at least to keep you circulated and losing weight slowly. So weight loss means you must not reduce drastically. So by doing intermittent fasting, doing regular exercise, you have to lose weight gradually. Next slide, please. And this is gallbladder polyp. Polyps are nothing, it's not a malignant one, but the polyps are malignant means it's not cancerous or any dangerous one. The gallbladder polyps are abnormal growth of tissue that protrude out of the inside mucus. A small layer will be there in the gallbladder mucus. It will be a there small protrusion also. It is different kind, made up of different material. They are mostly harmless, but they can be sign of another gallbladder problem. Whenever you have a gallbladder stone, definitely you may have chances of getting gallbladder polyp also. Next slide, please. So people with high levels of cholesterol or salts in their bile have an increased risk of developing gallbladder polyps. This gallbladder or polyps are associated with formation of gallstones. Many people have both gallbladder polyps and gallstones. So as we discussed earlier, gallbladder polyps are associated with gallbladder stones, and people who are obese and who take high cholesterol foods, high salty food, have prone to get this gallbladder polyps. Next slide, please. And as usual, diagnosis can be done by ultrasonograph and CT scan. CT scan will reveal any obstruction or there in the gallbladder or any polyps are there. Those things can be diagnosed through CT scan and ultrasound. Next slide, please. And okay, fine. In allopathic medicine, that is modern medicine, gallbladder stone, whenever there is a formation of gallstone or cholecystitis or gallbladder polyp, the only solution is surgery. If obstruction is in the middle of common bile duct, they will be doing ERCP. So they will do endoscopy and try to dilate the common bile duct and try to excrete the stone outside. But the treatment solution will be finally removal of gallbladder. But in homeopathy, we treat the patient as a whole. So we take no organ is least important. All organs are most important in our body. So we take the case in detail. What causes this gallstones? Accordingly, we will give medicines to cure the gallstones. Few most commonly used medicines are calcareous carp, chelidonium, lycopodium, and natrum sulfuricum naxomica. These are the most commonly used medicine if the person is suffering from gallstones. Apart from this, we also give to strengthen your liver like Cardus marianus, Chernothes, and Feltori. The Feltori is the medicine which is prepared from ox gall. So these medicines help to promote expelling of gallstones. Next slide, please. So these are the few cases which we have treated in our clinic. The patient, Mr. X, complained of gallstone, renal calculi, and incisional umbilical hernia, inguinal hernia, and stranded omental fat. So these complications he reported me on 26 January 2001. And he has been prescribed that calcarea flow, Silesia, China. And the liver combination, what we give in our clinic is the combination of chelidonium and Cardus marianus that helps to strengthen your liver, that helps to expel the stone from your gallbladder. So after certain days, I think next slide, let me check. 28 May 2003, completely the gallbladder is dissolved and gallbladder is contracted. What is the meaning of gallbladder contracted? Whenever you eat food, non-veg food or fatty food, the gallbladder contracts and it expels the bile for the purpose of digestion. So the non-functional gallbladder, already stone formation is there. After homeopathic medication, the gallbladder has started functioning. That shows this gallbladder is contracted. So it contracted and expelled the bile out for digestion. So he became normal. Next slide. So these are my patients review, those who are treated with homeopathy for gallstones, and they got good recovery within short period of time. Few patients will recover in 8 months or 3 months. Few patients may take 1 or 2 years. Depends on the body, how your body reacts to the homeopathy medicine or how your body vitality accepts the homeopathy medicine. So definitely this homeopathic medicines can help to save your gallbladder. Simply removing every organ from our body like tonsils, adenoids, uterus, gallbladder, ovary, so and so. We can't say, but keeping or restoring the organs healthily in a healthy human being is the mandatory. It is the must of homeopathic medicine. So, next slide. Oh, thank you. We are in last slide. Thank you very much. So, if you trust homeopathy, if you want to save your gallbladder, you can trust homeopathic physician. You can discuss with your physician in detail how it works, what causes gallbladder stones, why it is happening. So you can discuss in detail with the physician whomever you are. If you want to consult online also, you can contact this alternative health people. They can help you to communicate with you. Thank you all.
Thank you so much. Thank you so much. We do have the question and answer session right now. If anybody is interested to place questions, there is the Q&A tab available. You can place in your questions. Doctor, there are a few questions that have been put up in the chat. Would you like for me to read it and then for you to answer?
Yeah, please.
Sure. The first question, how does homeopathy specifically target and treat gallbladder conditions?
As early I said, homeopathy will not target on your gallbladder specifically. We treat the patient as a whole. Whenever a patient comes to us, we see what making him causing stasis in his gallbladder. See, stasis is not simple stagnation of bile in the gallbladder. Stasis may be present in the mind, stasis may be in many system in his body. So we take the case in detail. Whenever we take totality of the person, there will be some kind of stasis in his life that may cause stagnation in his gallbladder also. So in that way, we are focusing patient as a whole and we are giving medicines to treat his gallbladder.
Thank you, doctor. The next question: what lifestyle and dietary recommendations complement homeopathic treatment for gallbladder?
As early we said, we discussed in diet topic also, limit animal proteins. Don't take excessive fat, oily food or fried items. You can go with water soluble fibers and you can take tuna, mackerel, salmon, these kind of fishes you can take as a gravy, not as a fried item. And you can take more of green leafy vegetables, which helps to improve your bowel movements, and take less flatulent food, starchy food like potato you can avoid, and starchy foods you can avoid. That will help to improve your gut absorption power and helps to ease the gallbladder pain.
The next question, doctor: can homeopathy be used alongside other treatments for gallbladder issues?
Yeah, definitely. Homeopathy is a best complementary medicine. Whenever you are in a chronic disease, like you have been treated for hypertension or diabetes or any other chronic diseases with modern medicine, you can supplement or complement with homeopathy medicine. Definitely, that will help to reduce gallbladder issue. And if the doctor is prompting you or diagnosing you appropriately, then your overall issues will be reduced by taking homeopathy medicine as a complementary medicine.
The next question, doctor: what success rates have been observed with homeopathy for gallbladder issues?
Madam, I have been treating this gallstone since 2002, almost 21 years I am treating. Most of the cases have been succeeded with gallstones. Probably we can say 10 to 20% failure because of patients impatient. Patients are impatient because they want everything in hurry. So they keep on changing doctors or they won't come for regular follow-up. So I can say 20 to 30% failure. So 70% will be the success rate for gallstones. Without surgery, we can treat them.
The next question, doctor: is homeopathy suitable for individuals with severe gallbladder conditions or previous surgeries?
Madam, I have treated many cases, those who have affected with severe cholecystitis. In gallbladder condition, cholecystitis is the worst condition, which immediately they will develop severe pain, fever, rigor, chills, and vomiting and nausea. They can't even drink water. If they drink water, they will vomit out. And during this gallstone expulsion, it may obstruct the pancreatic duct. That may cause severe pancreatitis. Those cases also we have treated very successfully with homeopathy medicine. The main condition is the patient must reach the doctor at appropriate time. If he comes on time, we can manage him without any surgical intervention. If the gallstone is stuck inside the common bile duct, definitely surgical intervention is needed. As I said, that endoscopy, ERCP is needed, mandated. If the gallstone is very small, we can try to expel it out by medicines. If you see the common bile duct is 6 millimeter size. If the stone is 4, 3, 5, we can give medicine to expel it out. Sometimes the stone size may be 7 mm or 8 mm. It may stuck into the gallbladder. That time definitely we need surgical intervention.
The next question, doctor: how long does it typically take to see improvements with homeopathy treatments for gallbladder issues?
Yeah, already we discussed. No, this mainly depends upon the patient's lifestyle. If a patient, if, for example, if a Islamic person, Musliman coming to us, they will be having non-veg every weekly, 3 days, 4 days. So those conditions, it may take very longer duration. If you avoid, if you are maintaining proper diet, low animal protein diet, definitely we can give some better improvement within 3 to 4 months of time.
The next question, doctor: are there any specific homeopathy remedies commonly used for gallbladder health?
Yeah, I have showed in the slide also, calcarea carb, natrum sulf. These are the common medicine we use for gallbladder. And as we discussed in the presentation, homeopathy is individually, it's holistic medicine. So each and every person will get a different set of medicine. Not single medicine will help to treat gallbladder. But I mentioned the Feltori, the medicine prepared from ox gall and colostrinum. These two medicines can be taken individually. Any gallbladder patients can take these medicines to improve the gallbladder health, because the colostrinum is the medicine which help to dissolve the cholesterol formed in the gallstone, and Feltori helps to improve the functionality of the gallbladder.
The next question, doctor. Can you use homeopathy treatments for gallbladders during pregnancy?
Yeah, you can use. Homeopathy is 100% zero side effect, nil side effect. Even in pregnancy, you can take homeopathic medicine. If the gallstone is very small, 4 mm or 5 mm, 6 mm, 8 mm, you can use homeopathy medicine. Even 10 mm, 15 mm, you can use, because small stones only will cause problems by getting obstructed, or while passing out, it may block the pancreatic duct. So these kind of complications happen only in these small stones. But homeopathy medicine helps to dissolve the stone, and then only it will try to expel. So whenever you are taking homeopathy medicine, you can see in the ultrasonography of every reviews, we can see ultrasound. Stone will be reducing the size, then it will become sludge. Sludge means a mixed mass. Then it will expel out. So homeopathy is safe during pregnancy also.
Another question, doctor. Are there any side effects with homeopathy?
Homeopathy is harmless, 100% zero side effect, because we minimize the medicine dosage. For example, if I'm giving the chelidonium, the medicine name is chelidonium or calcarea carb. One part of calcarea carb will be diluted with 10 part of alcohol and medicine. We triturate, we potentize. From that one part, we take another 10 ml, we potentize. So like this. Those who remember physics, Avogadro's number, homeopathy medicines are 10 to the power of 28. It is beyond Avogadro's number. That's why modern people are claiming homeopathy is placebo. But recent days, MIT, that nanotechnology as growing, they started proving that even in the homeopathy, molecules are present in the dynamized form of medicine. Homeopathy acts upon physics law. So there is no side effect in homeopathy, because it uses very, very minimal nanoparticles of the medicines.
Thank you, doctor. The last question for the webinar. After treatment of gallbladder stone, is there any chance for getting it again and again?
See, purely depends on the lifestyle. We cure gallstones, we dissolve gallstones. If you are not drinking proper water, if you are keep on taking too much of non-veg foods, high cholesterol food, high salty or seasoned food, then you may have the chances of getting recurrence. But once the concept of homeopathy is curing the patient permanently. So your gallbladder will become all right. In some cases, if you are not following proper diet, you may get recurrence also. So our body, if kidney stones, if you are not drinking enough water, you may form stones. The same way, if you are eating too much of cholesterol item, fatty foods, you may have chances of getting stones also, but it is treated easily with homeopathy.
Thank you so much, doctor. I think we're just done with the questions as well. So this brings us to the conclusion of the webinar. I would firstly like to thank Doctor for taking your time. We really appreciate the time that you've taken to explain this and even give us the remedies, even take out time to answer these questions. Thank you so much, Doctor. Thank you so much to everybody who has attended the webinar. We hope you find this informative. If you want to discuss with Dr. Nirmal a little further about this, you can always go into our website, which is app.alternative.health. You can register yourself and we will get you the first help that is required to you, and we will get you connected to Dr. Nirmal so you can discuss further one-on-one. You can get the required remedies, you can get the required treatment for your health. And please do visit our website after this webinar and look at the various specialists that we do have at our panel. And thank you so much, everybody. Once again, thank you, doctor, once again. We hope that going forward, a lot of people do come forward and they do take in your help regarding this. Thank you so much. Thank you, everybody.
Thank you. Thank you all.